Good morning.
Good
I'm
morning.
Crawford. I'm the Director of Clinical Trials and Patient Education at Prostate Health Education Network. Um, this is June 10th, and it's going to be an interesting topic today. And we're looking at it from a different perspective, from the eyes of the people who support the prostate cancer patient. So we know caregiving, caring for the caregiver, emotional well-being, and survivorship is kind of the overall topic. But before I go any further, I'd at least like to thank our online audience, as well as those in attendance today. Also, the people that sponsor this program on a monthly basis. Amgen, Bayer, Dana-Farber Cancer Institute, this is our host institution. Alexis, Johnson & Johnson, Merck, Novartis, and Pfizer. And without their generous support, we would not be able to bring topics that are rarely talked about. So what's important here is that, yes, caregivers' emotional well-being is going to be the focus. We're looking at how they survive during the prostate cancer journey, because this is a unique experience. And it's a unique experience because we're going to have the wives of prostate cancer survivors. And so this is important because many wives do not see themselves as caregivers. And so I want to be clear when we talk about caregivers today, we first thing, we see and honor wives. And wives honor their vow. So tonight, when we use the words like support and care and caregiving, we're not trying to replace the role of the wife. We are naming the emotional, physical, practical responsibilities that often come with loving someone through prostate cancer journey. So what I want to do first is I want to introduce our panelists. And these are wives of prostate cancer patients. I'll start out with Eileen, and then I'll move to LaDonna, and I'll move to Iris. Now, we do have ladies in the audience, Harriet, Sandra, and maybe some others who may want to tell their stories. We want to bring all the wives together to have this discussion. So, again, we are simply trying to name the many emotional, practical, and physical responsibilities that can come with walking beside a person with prostate cancer. And we're going into it quick because we don't have a lot of time, but we have a lot to say. So, first, I mean, could you take a few minutes, tell us about yourself, and tell us about a little bit about your journey? And I'm going to ask you the question: how would you like to be called? Wife, caregiver, or a combination of both?
Wife. Wife.
And wife. And LaDonna, what are you, a caregiver? Are you a wife? I mean, talk about wives have these vows. Sorry, I'm saying. But where other professional caregivers kind of check out. go home. But wives never have or rarely have the opportunity to check out and go home. Wife, caregiver, LaDonna.
Both,
Both.
both.
Okay. Now, Iris, wife, caregiver.
I would say that I am a wife.
Sandy, wife, caregiver.
Combination of both.
So speak a little closer into the mic.
Oh, combination of both.
Harriet,
Yes, I would say a combination of both. Years ago, I was trained as a nurse, so, being a wife, I would say combination of both.
I'm
Karen. So Karen is a next wife,
I'm a wife and a caregiver.
a wife and a caregiver. So I wanted to get a feel for just who we're caring for. And we want to bring it in and bring everybody in. So Eileen, tell us about yourself.
Well, I'm a 3-year cancer survivor. I'm the youngest of 9 siblings. 4 has passed away from cancer. 1 is now living with cancer. And by the grace of God, I'm cancer free.
And if you didn't mind disclosing what cancer you had?
Uterine,
Uterine.
yes. And
So
why I say by the grace of God, because it was a fast moving cancer.
Mm-hmm.
Yes.
Well, Donna, tell us a little bit about yourself.
So I am a mother, 3 sons, a grandmother of 11. I'm an aunt, a sister. I am a nurse, been a nurse for over 40 years. I think it's 44 now, and a wife. And thank God I have not had cancer.
So, ladies, well, Donna, since you're on the screen, tell us your connection to this prostate cancer survivorship journey. So, what's your connection? Tell us about your relationship to your husband.
Are you asking me?
Mm-hmm.
Okay. So, in 2016, Chuck was diagnosed with prostate cancer, stage 4, with metastasis to the bones.
Right.
And was given 3 years to live. And that's where our journey began.
So then, when you first heard your husband, Chuck, was diagnosed, what changed for you as a wife?
As a wife, everything. We had been married at that point for 35 years, and them saying that we only had 3 more years left, we had a bucket list of lots of things that we planned to do. I met him at 18 years old. We married at 21 and 22, and I have lived and been married to him longer than I was my parents. So my first thought was, what am I going to do? I just really scared. And then, how am I going to tell our sons? It was just a whole bunch of emotions.
Okay. Iris.
Yes.
So what is your connection? So you're, let me go back to LaDonna first. Was it localized disease? Is it disease being treated right now? Is it metastatic or disease has moved away from the site, the primary site? What are you dealing with?
It is metastatic. There is no cure, we're told. There was only remission and then another treatment, and remission and another treatment. And so after the labs, if the remission is over, then we're seeking another treatment. And that has been going on for 10 years.
Okay. Iris, your relationship to prostate cancer and what stage of treatment is your husband in?
I'm going to answer the first question first. Jerry is a 20 plus year survivor. He, at this particular time, is being monitored as needed to make sure that his levels are not increasing.
18.
And my history as it relates to prostate cancer is very long.
Tell us more.
My father, my uncles, many of them, my brothers, and other family members have struggled with prostate cancer. And I watched my father change. I watched my father, his body go through changes, and he eventually, died. So the history is long and it's painful. Very painful.
And at any given time, you want me to stop? If you want to come off the screen, get a drink of water, I want you to do that, because why this is so important and why Iris's story is so important, it wasn't as if this is her first traumatic event dealing with prostate cancer. This was something that she lived because of what she knew historically. And to me, these are wives, and that their experiences, which are distinctly different than the professional caregiver. And that's why this was an important topic today. Eileen, kind of the same approach.
And
What
my husband,
Mhm.
oh, I'm sorry.
Oh, no, go ahead.
My husband, Sherman, has had cancer for 22 years. Right now, he's in clinical trial. This is his second clinical trial. And he's been through a lot. He has been through quite a deal, quite a bit of pain, quite a bit of sleepless nights, the worry that we have for each other, for him, is overwhelming, and it's just a devastating disease to have, and to see your loved one go through such agony and pain. It's devastating.
Thank you. And I know, and like I said before, this is a difficult topic, but I wanted you to have this to be maybe your first time that someone's talked to you about how you feel and how you're dealing with this. Because many people think that support means appointments and medication and transportation and logistics, but what are these emotional responsibilities that the wife caregiver passed the carers. So what were you managing emotionally? How were you able to manage emotionally? And I'm going to start with LaDonna.
Initially, I couldn't. I cried, I'm sure, for 2 months straight. And I cried so much that Chuck asked me to stop crying and live with him and not die with him. And so I had to get a different perspective so that I could be stronger for him while he went through this journey while we went through this journey. But I started having panic attacks. I ended up on medication. I ended up in therapy. I had a tough time dealing with the fact that this disease may take his life.
Mhm. And I know you're a healthcare professional, but I wanted to ask Iris and Eileen, did you feel the same way during this journey, this supportive journey?
So, as a nurse, I wanted to take over. I wanted to orchestrate what was going to happen to him. And I immediately went into I'm in charge. And he asked me to quit it. Chuck asked me to quit it. Chuck said, listen, this is something that I have to do, and I need to be in charge of or make decisions about my body.
Right.
And that was hard for me too, because I thought I knew who to call and what to do as a nurse. I had friends, I had places for him to be, and he just asked me to stop and let him process it and to ask him before I did things so that he would be able to be in charge and make his own decisions.
Okay. So Chuck had to either take control or acknowledge, give you space emotionally. So Eileen, I wanted to ask you that question. Your husband has advanced prostate cancer, but you told us that you had cancer.
Yes.
How did that, how emotionally, how did you make it through that? That is tough because you're caring for a prostate cancer survivor who is fighting, and I take it he's fighting every day, and you're being his supporter or caregiver, but I think you're a little bit more than that. You're a cheerleader. And then how were you able to handle that emotional load?
It's kind of funny, but not funny. I was at the hospital with him getting his treatment at Dana-Farber. And my doctor kept calling me 3 different times and I wasn't able to talk. So I told her, call me when I get home. And we got home, sitting on the couch, and she calls and said, I'm sorry to give you some bad news. You have cancer. Me and my husband looked at each other, shocked. I was just in complete shock. He was in shock, and so was I. It was just like, oh my God. I'm there with him, and now I have it.
Mm.
Through it all, it was a lot of praying. I did a lot of praying. It was a lot of family support. And somehow I wasn't scared. And they say prayer works. And that's what I think helped me through it, and family as well. So really, I haven't cried about the situation. It's just like, it is what it is. Go through it. And that's where I am. I didn't look back and say, oh, poor me, or why me? I didn't do any of that. So I just had to do what I had to do. So I'm fine.
How did you balance your own fears and your emotional needs in this situation?
Can you say that again?
How did you balance? Because you had needs and you needed to be supported, but then you had to balance with giving support.
Well, it's easy giving support because he's the man that I love and I'm there for anything he needs. And I overlook, sometimes you overlook yourself for the person that you're so in love with. And to me, I don't know why, because I was concerned more about him than I was myself. I can't answer that, why I felt that way, but I did. Love is something else. I love myself too, but it's just, that's how it went for me.
So just a split second and just take a pause about how amazing, and just think about all those women that are out there that are caregivers, but their wives or partners who at 5 o'clock don't leave, who are on 24/7, not only for a certain task that they have to do for their family. And we should think about that. And that's why we're kind of drawing, I'm not saying a negative about a general professional caregiver, but it was time to hear from the people the loved ones. And we wanted to start with the wives. So, Iris, going back to the same question. What were you managing emotionally that others out there were not managing when it comes to, supporting your husband who has prostate cancer, their wives, that there's more that you're doing that we don't hear about? Could you tell me some of the things that you did that was distinct from what you may feel just a wife without a husband with prostate cancer or cancer?
I hope I'm answering your question, but I am a person of faith.
Mm-hmm.
So I, number one, had to rely on my faith and trust that God would see us through. One of the things, in addition to praying, I also started going with Jerry on appointments.
Mm-hmm.
And listening and being a part of the medical process. Of course, we talked about, next steps, what's best. We had some time, so it wasn't a rush situation in terms of what the next steps would be for him. And I also started to participate in the FIN group. Mm-hmm. So those are some of the things that changed. Those are some of the things that enabled me to support Jerry and have a clearer or better understanding of this cancer.
That was perfect. So what I'm seeing right now is this kind of an overlap between love and support. Would you say that's correct? Audience, you say that's correct? Audience too? You think so? Okay. So what is different about supporting someone because you love them compared to caregiving as a professional? What are your thoughts about that? And I kind of touched upon it lightly. I'll go back to LaDonna.
Somehow I knew you were going to pick me for that one.
I go right to left, okay.
Um, I don't know because I love him so deeply, and that I just went into mama bear mode. I'm just felt like I needed to fix this. I needed to make it better. So the nurse part of me and the wife part of me kind of collided together. Me as a scientist, me wanting to do it this way, and this way. You get this, and you get this, and him saying, "No, that's not what I'm going to do." We had a lot of fights about that, um, about what his choices were, view what I felt like that he should be doing, and he looked at a lot of um, alternative medicine online, and I understand what he was doing, but I had my tunnel vision on science says this, and this, and so um, and so we had a lot of colliding thoughts, and I really had to let go and allow him to be in charge of his care. So, but as a support person, and support him and not try to fix it, because I couldn't fix it. There was no way I could fix it. I just had to allow him to do what it is that he wanted to do, so that if it was time for him to go, that he went the way he wanted to.
Okay,
Mhm.
so Iris, same question. And I'll backtrack a little bit. So we know we're looking at this relationship between love and support, how it overlaps. There's a difference between a wife, there's a difference between a caregiver, there's an area or a nexus of overlap. So how do you feel like this shared, and we're gonna go into, I take all of the ladies online, have a strong religious underpinning. Are we in agreement? Because there was a lot of praying. So, Iris, how does shared history, marriage, love make the experience more personal? Your thoughts compared to just a professional caregiver. We're not trying to beat them up. I'm just saying that you do more.
What was that last thing you said?
I'm not trying
I'm
to
sorry.
be a professional caregiver. I'm just saying there's more that a wife does than just the standard caregiver or professional caregiver work. And so since you had this past history, that's another your marriage and how you love each other and makes your experience more personal. How do you feel it made your relationship stronger? Did you do like LaDonna and just allow your husband to take more control? Was there a time when you had to step up and shake him a little bit to kind of get him on the right track because you love him?
There's a special partnership, a special bond that I have, and I'm sure all the ladies on the panel have the same bond with their husbands. It's unbreakable, and I had to do what I needed to do to support him. So whatever he needed me to be at that time, cheerleader, wife, encourager, caregiver, whatever, I did my best to step up to that plate. I also witnessed my mother caring for my father and being by his side until his death. So I had a great model.
Mm-hmm.
And there were other ladies as well, but I have to look back at my mother and how she handled my father's sickness all the way up to his death.
Mm-hmm.
So when I found out that Jerry had been diagnosed, I thought about death.
Mm-hmm.
I thought about my dad and my mom. So
What was different then between your dad and your mom and what you initially were exposed to what you were you anticipating it going to be the same, or was it different?
I was expecting death. Cancer, when I hear cancer, to me, it's death. And it's usually painful death to watch someone deteriorate. A close family friend came up to me in a FIN meeting and he told me, he said, Jerry's not going to die of prostate cancer. I heard him, but we had a journey in front of us and I didn't know the outcome. I didn't know how it was going to end. But because of my faith, because of my history, what I had witnessed, mainly because of faith and trusting God, we were able to do what we needed to do to get through.
Eileen, would you like to comment?
They said it all. They said it all. It's just like I said, I really don't look at it as a caregiver. That's how I feel. I look at it as my husband. That's what I'm supposed to do. The vows that I took. That's just how I feel.
Mm-hmm.
Yeah,
So
but they said, yeah.
Tremendous love. So I'm going to, 1 second, panelists, I'm going to go to the audience here. Karen, love? Can't hear you. Love?
Yes.
Harry. Yes, Harry.
So what was the question again? Oh,
So we were talking about there's this relationship between support and love. And the simple question is, did love pull you through this journey? Same thing.
well, definitely love pulled me through. And so when Jim was first diagnosed with prostate cancer, I prayed and I felt like God, really strong that God said he's going to pull through. And the next week I told Jim, God said you're going to pull through. And Jim said, oh my God, I prayed too, and I heard the same message. And so from the very beginning of his journey, we believed God's word to us individually, and it was like a confirmation. So we went through his journey, I think, differently, knowing that he was going to pull through. And we had doctors here.
So
Who-
prayer, belief in God and your love
Right.
help pull you through.
Yes.
Sandra,
Yes.
what about you? Love alone, spiritual?
All of that, combination of it all. I mean, Azel and I have been married for 54 years. We've been together 54 years, which exceeds, living with my parents and all of that.
Mhm.
So he's everything to me. He's my world, and with our children and our grandchildren now. I was devastated when I, first heard that he had, well, initially he had prostate cancer, which was over 10 years ago, and he was in remission. But more recently in December, he was diagnosed with multiple myeloma,
Mhm.
which floored me.
Right.
When they told me multiple myeloma, and I was like ready to pass out in the hospital. But I had to be strong for him, you know what I mean?
Right.
So, he was in there for a month. I mean, I didn't know what was going to happen to my husband. Every day we were pumping him full of medications and this. And so I had to reach out to you, Dr. Crawford, in Fenn, because I had talked to Tom because I didn't know. And then Tom said, Sandy, he's going to be okay. I have it too. And it was like God speaking to me. He said, and I live with this. Because I thought it was a death sentence for Azel. I really did.
Mhm.
He was like at death's door. And then blood clots and this and that, in his lungs and this. I mean, so much happened in the last 4 months that I didn't think I was going to make it through, let alone him. But with the support of Finn and God, I mean, because my faith has always been there.
Right. Right.
But I tell you, God speaks to me. And friends on prayer lines all over the world, because I'm connected with prayer people, prayer warriors, and he said he could feel the prayers. And every day I went to the hospital, I could see the gleam come back in his eyes. And I mean, it was like, it's been hell, but we're back. God is with us. God is at the wheel, I tell you, because today he even drove us here. I let him drive under supervision. But he drove here today, and I'm just so
God
thankful.
or Azel?
Both of them.
Oh, okay. Okay, so both of them drove you today. Okay.
That's right.
Good.
That's
So
right.
we've been to hell and back, but God has brought us through the darkest of days, and I see light for eternity. I mean, he's back,
Okay.
and he's going to stay back, because I have studied and read and know everything there is to know about this illness. I mean, I make sure he gets his meds on time. He gets his meals. He's gaining weight finally.
So you had there was a point, it's like
We're on,
you prostate cancer and then something else crops up again. And then,
10 years later, or 12 years it's been, I
Mhm.
guess. And they said that, it was like laying dormant, just waiting for something to break down in his body.
Mhm.
And he kept getting sciatica.
Right.
And it was so bad, this last incident in December, that
So I see.
they finally gave him the MRI to determine that it was not sciatica, it was multiple myeloma.
So love. Support,
That's
and
in his pelvic
quality.
area. That's where the cancer, just laid dormant, waiting for you to break down, and then it just lashed out. And it was like all through his pelvic area.
Okay. So, but thank you for telling
But he's good.
he's good and driving.
And thank you all. God bless Finn, I tell you.
Well, thank you. Thank you very much. Now I'm going to head back to the panelists. So there's an underlying theme here. There's a strong question pointing at each other. Faith your vows, and your commitment. Is that something that you feel separates you from the professional caregiver, or why there's all kinds of different caregivers out there, but you're unique, and loved ones or spouses or significant others, or children, they're different, but you guys' wives are significantly different because you took a vow. And what I hear here is the vow, the faith, and your commitment to love. Do you feel that that's accurate? Is that what we're hearing here? That distinguishes, maybe some points that distinguish you from just the average caregiver or professional caregiver?
Yeah, I think we're special. Truly special. Yeah. Because I think that
You said, Mike?
men I think men who don't have a loving spouse or someone to caress them when they're in pain, or whatever, just to touch them and hold their hands and say, you're going to be all right, honey, and God's got you. Those kind of encouraging things. I think it's very hard for someone to get well. You have to fuel and water and feed someone who's sick. And if you're just putting a dish there and say, here's your food, that's not really fulfilling the person. They don't feel you.
So that the fact
I
that,
think they have to feel you.
yes,
Arguing is good. All of those elements are, make them feel more alive and flourishing and
Right.
being part of living,
right. So were you ladies online? Were you able to hear them? So what do you think? What would you like to add on to that?
I would like to say, because I had been a caregiver, that's the separation was very hard for me. And I think I've kind of said that a number of times. So now going over to the other side and being the receiver of the news and having to figure out a way to move the nursing out and just be a wife, is what Chuck was asking me for. And so, in his darkest times, when he had lost 80 pounds, when I thought he was going to die, when he was, looking all sunken and couldn't hardly eat and couldn't hardly walk, that was the time when, I really drew upon my strength from God, praying. I mean, people were praying the whole time, but that was the time when I had to really say, dig deep within and say, this is your trial too. And you have got to get a hold of yourself and be able to go through this, and be his support. And so, and so I do think the three kind of, go together. But at some point I had to push the professional role to the side and be that wife and support and person that he needed, and give him, his autonomy to be able to do what he needed to do to be better. And he told me, he said, I'm not going to die. And I was so sure he was going to. He said, I'm not going to die, LaDonna. Would you stop it? And so, and he's alive today. I mean, the man is.
Oh, how many years are we talking about now?
Amen.
We talking about 10 years he survived when they only gave him 3, and he's getting fat. And I love it. And I keep shoving it in.
You can still shoot the 3 though. Okay.
But now we're married 45 years. So when she said 54, I'm like, yes, I have more to go. So, so yeah, for me, that was a clear difference. So.
So Iris, how about you? Were you able at any time to kind of shift from, the supporter, cheerleader, all around 360-degree woman to just be the wife again? Oh, you're muted. You're mute?
Okay, I'm on mute.
Sorry.
I never stopped being the wife.
Oh, you never stopped being, okay.
I never. I just,
So you just 360 degrees, 7 days a week, 24
what,
7.
whatever I needed to do, I tried to do that in the whatever role I needed to be in. I never stopped being the wife. And in terms of faith, I view this life as a journey. And there's no way that I can make it in this life without my faith. I don't know what the next second, the next minute, I don't know what lies ahead. But the only sure thing that I have is my faith. And I trust God will be God and see me through whatever comes ahead. We live in a world in which anything can happen at any time. So this sickness, disease was a part of the journey. But the journey continues. The faith will never go. It will always be a part of me and Jerry. So whatever I needed to do in whatever role, I was always his wife, his partner for life.
So you were able to balance, split the two roles, or it didn't really matter? Because the point is, you just did what you needed to do at the time you needed to do it.
Exactly.
Eileen?
You're so right. It's just being a wife, I think. I mean, if your heart is in it, your mind, your soul is into it, you're going to do it, and you're going to want to do it. And the vowels, yeah, but the love is so strong that you want to do it and always be there. I never been I don't like the word caretaker, really. Caring for anyone except for my kids. And I used to go visit my mom at least 2 or 3 times out of the year. She just passed away at 106. And to see my sister as a caretaker, it was tremendous on her. It was devastating. She did it by herself. And she's been doing it for over 40 years. And she didn't die from cancer, though. She was just a caretaker. And I've seen everything that she went through as being a caretaker. And it's hard. It's hard. But really, the separation is it's just not good. It's faith, prayer is there, and it works. It has been working.
Okay. All righty. So I was going to ask, what encouragement would you offer another wife walking this path, walking this journey? Eileen?
Would say if it gets too hard, ask for help. Don't try to do it by yourself, because I know it wore my sister down. It will wear your body down. And if you're worn down, you can't help yourself, or you can't help the person that you're caring for. So that's what I would say. Get help when needed.
Iris? Oh, you.
I would have to say, seek support, and Finn was very helpful. Finn was very helpful in helping me understand what this disease is all about. And on top of that, there was a wife or support session for women. While our husbands were in a group, first we met together as a husband and wife, everybody, the whole team, the whole Finn group. And then later on, the men had their own session and the women met as a group as well. So just basically finding the support to understand and get through the process. Also, staying on top of the doctors, the medical piece is important too, and knowing your options.
So groups, advocacy groups like us
Yes.
are supportive to the wives also. Where you pick up the phone and call. You can use some of the tools that we have available. Or you just send us some pictures when you're getting treatment in another country. How good, how a nice time you were having. But and I say that because I'm transitioning over to LaDonna. Your thoughts?
So I was one of 10 siblings, but I'm in Massachusetts by myself. And my three sons were very little help. They would come in and then burst out crying, and then I'd send them out the door because they couldn't see their father like that. And I didn't know about Finn. So, and I asked the hospital, was there help? Was there support groups? And there wasn't any. And there wasn't anything in my church. The elders did come over and pray for him. Um, but um, but I just felt so very alone. And so I don't want that to happen for anyone else. So to get the word out that there is Finn is very important. The way I found out about Finn was through Dr. Gloria Cater. She was a work with me at my job, and she told me and Chuck that Finn was available. And so then he started to work with you, Keith, and it made a big, huge difference, especially for him, knowing there are other men who have prostate cancer. I mean, he knew that his father died of prostate cancer, but actually doing something about it, because and talking to other people. And so I'm thankful that Finn is here and that I know about it now and that I can tell others. And now we just spread the word and tell everybody about Finn. But the lack of support outside of Finn is real. There aren't any support groups that are specifically for families of or wives or caregivers or um, who have prostate cancer. And it's just something that we'll have to work on.
And we're continually working on it, even expanding our reach. And this is why this was very important. I wanted Jerry to release the survey questions, but I wanted to open the floor here at the Dana-Farber, and the ladies here, the wives here, what would you like to tell someone? Because their husband just recently diagnosed with prostate cancer. And what are your thoughts? What would you want them to leave them with? Sam.
Numbers, phone numbers of of caretakers or
Mhm.
wives of survivors, or even if they're in husbands are in treatment, you know, to give them support. If they have questions, how to navigate the system, you know, whatever questions they would have, that there's a cadre of women who have been through it for many years and can help them.
So we're
And
talking about here, we're talking about again, reaching out,
yes.
reaching out. Harriet, your thoughts?
Yeah,
So, when I went to my first FEN meeting, it just little by little started to answer all questions. And yes, I needed support, but I needed answers. I needed to know. And so I would just strongly urge any wife to attend regularly these FEN meetings. It just gave me such peace in knowing that there were cutting edge discoveries out there, and FEN was there. They looked up beyond the horizon and saw what's going to be possible, not perhaps, but what's going to be possible. And that meant just all the world to me.
Mhm. And I'm glad, and that's what we're, trying to do. And we try to do better tomorrow than we did today. Hopefully we can touch many, have even expand to having more of these sessions with wives and caregivers, loved ones, to talk about, help this next generation of wives who will be caring for men along this prostate cancer journey. Anything else? No other comments? Okay. So Jerry, where are we?
Morning.
Okay. So let's go back. There was one question that came up. Oh, okay. Let's go back and ask the question, and especially with folks online also. What would you want? What would you want the caregivers, family members, so the wives, you're taking a brunt of all this stress, anxiety, and you need to have time for your mental health, your mental health, your wellness. What would you ask from other family members, community, church? Who can give you this help? We talked about therapy or a therapist but are there any other people out there that can, other than what we're doing with Finn, can help? And what should they? And yeah, that you think should be able to help. Say, for example, Donna, I'm going back to you for a second.
that's a hard one for me because that would depend on what Chuck wants. And
Right.
I've learned to step back and say, do you want someone else here, or for his care or whatever was going on. And usually he didn't want anybody else. But he didn't want people to see him the way that he looked at one point, when we like almost put him in hospice, because he had deteriorated so much. And he didn't want anyone around. And so then so I would say that I would have to ask him and say, what is it that you want? Is it all right if someone, else comes over? Probably my sisters who have been around for a long time, but again, nobody was in Massachusetts. And so it just wasn't the ideal situation for support for me. And even some of the people from the church, he just didn't want others around. He just wanted me to be there. And so that's what I did.
So I hear this theme, religious theme coming through. So also we want to make sure that all your churches are aware of Finn. And so those folks in your church can also benefit from some of the tools that we have, some of the information that we have available to all people on their prostate cancer journey. So anything else anyone wanted to say before I go into the closing? Okay. So, Jerry, press.
Okay. Results. Our results. Good. Yeah. Okay, we're good.
Okay. So the first question, do you understand how cancer caregiving can affect emotional well-being? Completely, 84%, somewhat, 16%. Do you understand that caregivers may have stress, fear, guilt, sadness, worry, exhaustion? Completely, 90%, somewhat, 10%. Do you understand how caregiving may be different when a loved one is in an active treatment for metastatic disease? And 74% says completely, 26% says somewhat. Do you know the signs that a caregiver may need more support? 45 said completely, 55 said somewhat. Do you know ways family, friends, and care team can support caregivers? 59% said completely, somewhat, 41%. And this is a key question because we're opening the door to allow wives, the wife caregiver, the significant other caregiver, the children, to really release, discuss, decompress in relationship to this disease that they're on the journey with. And it's all right, right? It's all right to feel the way you feel.
But they may be overwhelmed,
True.
okay? And they may not necessarily be on, how do I put it, on the side of wanting to keep defending or taking care of the situation. They may not even want to deal with the situation, so they do need a respite or something.
They do. And that's one of the most important takeaways. It is all right to feel the way you feel.
Amen.
Don't feel bad. That's why we're talking about this, because it's a lot on you. And nobody really takes the time to allow you to talk and feel safe.
Or get rid of some of the guilt you may have in the situation, thinking, did I do enough or have I given enough?
Correct.
You've got to look at the other vice versa, saying, what else is there? What else could I have done? You know, and sometimes we call ourselves questioning. We may question something knowing whatever, but did we do enough of this or do enough of that? So some of the questions are a little bit misleading.
Mm-hmm.
Okay? I mean, or just couldn't basically be completed properly.
Yes. And so I'm glad you brought that up, because you have to be comfortable enough. It's okay. That's what I'm saying.
Okay.
It's okay to feel the way you feel, and it's okay to express that. So 6, did the program allow adequate time for audience Q&A? And 75% said yes, 21% said somewhat, 4% said no. Would you recommend the session to others? 97% said yes, 3% said somewhat. How would you rate the quality of the panel discussion? 79% excellent, 21% good. Would you attend another survivorship focused session? 97% said yes, 3% said maybe. How did you feel about the session's pace? 89% said just right, 4% said too fast, 7% said too slow. Were you satisfied with the meeting and the presentation content? Very much satisfied, 86%. Somewhat satisfied, 14%. And let's see who was in attendance. So 69% were prostate cancer patients and survivors, 14 spouses and caregivers, and advocates, medical professionals, community leaders, and others are the smaller percentage. So one, I want to thank you for coming. And I had some words I wanted to think about. So tonight's conversation reminds us that wives and partners are not just helping with a task or with tasks. They're carrying love, history, vows, fear, hope, responsibility. Whether someone uses the word caregiver, wife, supporter, partner, or advocate, the message is the same. People walking beside survivors need care, support, and recognition too. So thank you very much for attending this session of Prostate Health Education Network, Managing Survivorship. Next week, exciting, more educational for you. Bye.